I wish I had more pairs. I need more pairs.
How about this? And then I don't look like an old lady with little things hanging down.
Yes. Hello, welcome to City Club of Eugene's December 2nd, 2022 program, Preventing Elderly Homelessness. This is the 11th program of our 2022-2023 programming year. My name is Karin Knutson, and I am City Club's president. Welcome to everyone here with us and listening today. It is a pleasure to have you as a part of this important community conversation. For almost 30 years, the City Club of Eugene has been delivering our mission to build community vision through open inquiry by coordinating weekly programs on topical, engaging community issues. City Club creates the space for civil discussions about civic issues, and today we turn our attention to the experience of elderly homelessness. Support for the City Club of Eugene is provided by our members and both business and in-kind sponsors. Our diamond sponsors are Kaiser Permanente, the University of Oregon, Peace Health, and Lane Community College, and we appreciate the support of the City of Eugene and Lane County. You too can support City Club's mission and weekly programming by becoming a member. Visit our website, cityclubofeugene.org, and join us. We invite you also to join us in person for City Club programs and to hear directly from local, national, and international experts on current local events. We also encourage you to ask questions of these speakers with us, and today is no different. We'll have a Q&A following our speakers' remarks. Thank you to Ralph Pledger for coordinating today's program and for his incredible work behind the scenes to produce City Club programs every week with our audiovisual team. We appreciate you so much. And now, about today's program. As you know, Eugene, Lane County, Oregon, and indeed the entire West Coast faces a housing affordability and housing stability crisis. But the profile of our local housing crisis is unique, tethered to demographics, high instances of homelessness, and our housing stock. Today we'll look at the issue of housing instability among our older residents, the baby boomer generation, and discuss solutions. To offer some context for today's program from the Department of Housing and Urban Development and Harvard's Joint Center for Housing Studies, quote, as the baby boomer generation ages, demographers project significant increases in the proportion of the American population age 65 and older. Indeed, the Harvard Joint Center for Housing Studies projects that the number of US adults over age 65 will grow from 48 to 79 million over the next 2 decades. By 2035 alone, we expect 50 million households in the United States, approximately 1 out of every 3, to be led by someone age 65 or older. And the number of people age 80 and older will double to 24 million. The older population will also become more racially and ethnically diverse, and with non-white share of the population expected to increase from 22 to 31%. Many of these individuals' households will be single-person households. Many of these individuals will be living alone. The nation's existing housing stock, in terms of its options, affordability, and accessibility, is generally ill-suited to meet the housing needs of increasingly older population that overwhelmingly wishes to age in place. But maybe there are some ways that we can think creatively about this existing context. In today's program, we will explore how affordable housing for seniors has become one of the leading challenges in our state, discuss the reality of aging in our economy, debunk common myths, and also hear some creative strategies for success. How does housing insecurity arise as a challenge for seniors? And how can the concept of home sharing contribute solutions to this complex problem? Our speakers today include Julie Cormana-Smith, the Area Manager for HomeShare Oregon, and Donna Courtney, RN, a board-certified case manager and the owner of Adult Living Solutions in Eugene. And now, Judy, welcome to City Club. Excuse me, now Donna, welcome to City Club.
Good afternoon. I appreciate the opportunity. Oh, thank you. I appreciate the opportunity, we both do this afternoon, to talk about what the face of the unhoused really looks like. I think that the homeless population has changed. It's changed across the country. It's changed in Eugene and the state of Oregon. So in looking at homelessness or the unhoused. We are hoping today we can give you a different perspective of how folks get into this position, because honestly, in the practice that I have here in Eugene, anyone can become unhoused, and I see it often. So if we can talk about being proactive and what might help prevent being unhoused, we want to think that it could help you and your family members and your neighbors, extended family, should they get into that position that they're going to be unhoused. So let's see here. One of the things I wanted to talk about that are common myths of being homeless or common myths of retirement is something that you might be familiar with. I can retire just on my Social Security and be covered. That is a very common myth. The unfortunate piece about that myth is the average Social Security in our country is about $1,500 a month, and in Oregon, it's about $1,345 a month. So if you're depending on your Social Security covering your needs, you need to rethink that. Well, I have Medicare. Medicare will take care of all my needs. Well, that's really not true. One of the things that people get confused about is Medicare and Medicaid. Medicare is a health insurance policy that covers your medical needs. Medicare does not cover your living situation, your home, if you should need care. You'll have skilled care through Medicare, but Medicaid is really the program that covers an individual if they meet the medical criteria and they are without resources to pay for their own care. It is complicated. Well, I've been healthy. I've just had a little arthritis. I really don't need long-term care insurance, or I don't need to worry about what medical costs are going to be in the future. And that is truly a myth that I work with every day. When I hear the words long-term care insurance, it's music to my ears. Because as we all age, there is loss of memory. It's part of aging. And people age at different degrees. So you may have an early onset dementia, or you're in your 90s and you have some memory loss, but it's an unknown factor of when you might need physical and emotional support in your home. And it is something that I think our culture doesn't look at very well. You don't realize that there's going to be changes and you really don't prepare for it. And when it happens, it's kind of a stunning, catastrophic situation, or what we call it in the medical field is a sentinel event. People can do okay, maybe not perfect, not the way they'd kept their house and their yard and their finances, but there'll be a sentinel event that'll happen, a hip fracture, a fall with a head injury, something that changes the situation that's no longer amenable to be able to live by yourself. And then what do you do? Currently, right now, the costs of care are, if you have in-home care around the clock, it's about $24,000 a month. And Medicare does not cover that. So this is the one that I hear a lot, especially I think more for women than men. My kids need my money more than I do. Good stewardship as you age is so important. And you know, the kids think that, oh, you know, you've got plenty of money, we'll just ask mom or dad. But you cannot plan for what might happen very well without some resources. I always want to caution folks to give away their money. If indeed Medicaid has to be a part of the picture of your care, Medicaid will go back 5 years, and if you've given your money away to your children will have to be responsible for your care. And I don't know that anybody wants to have to rely on their children to be able to have care. And again, the government will take care of me if I run out of money. Well, sometimes that works out okay, sometimes not. You have to have actual physical hands-on needs to be able to have Medicaid to come in and care for you. And then the situation is there may be 10 people on a waiting list right now in the hospitals here locally. The discharge planners cannot get people out, and especially if they have Medicaid. Well, we're post-pandemic, there's not enough caregivers, and if you're on Medicaid, the communities have a lower amount that they take for a Medicaid resident, and there's so many private pay per Medicaid residents, there will be waiting lists, and so people are staying in the hospital because they can't find places for them to go, or in rehabs. The state, to their credit, has had 2 programs that provides extra money for a community that will take a Medicaid resident, or actually anybody. It was $10,000 earlier in the year. We're going to give you assisted living $10,000 to take this person because we can't find a place for them to go, and that's extra money that they get, even though they get a lower reimbursement level per month. The program that came out in this last month, we will give you assisted living or memory care $5,000 now if you take these folks that we can't find homes for. So we're having a crisis situation across all the levels of care to be able to know how to take care of people. One of the things that we wanted to bring the perspective of is the word unhoused. There is a stigma around the term homelessness. Homelessness, as my slide says, this term carries baggage that brings connotations of personal failings, drug use, a lot of stigmatizing assumptions. People that have garbage, they don't take care of themselves, drug addicts is a lot of the words that come to mind for homelessness. The picture of a 58 or 68-year-old woman that unfortunately has been through divorce, that has lost her home, that is living on $900 a month now, and 1-bedroom apartments are $1,500, and by no action, no decision, poor decision on her own, brought her to this place of being unhoused. And this is the new face of the unhoused folks that we're working with now. It can be anybody. It can be a niece, nephew, neighbor, that there is no resources. There's a variety of reasons that it happens, but our hope and goal is to change the face of the unhoused. No one plans to be unhoused. And historically now in our community, it takes about $5,000 to be able to have first, last, and a 1-bedroom apartment. And if you don't have that money to put down, do you live in your car? Do you have how do you feel respected as a person that's always had a home and a job and took care of themselves, and by these circumstances, here I am. So, and just to be a little more specific, and I don't know if you've heard, that there was an unhoused woman that died in South Eugene Hills this week. And we're still trying to figure out what happened. She was unhoused, and it's in our neighborhood. One of the things I didn't realize is there are obituaries now for unhoused folks. You know, obituaries in our newspaper cost money. And, you know, to have an unhoused obituary, at least you know about this person's life. So it's pretty sad. And again, we want to speak to divorce, medical costs, emergencies, and of course, the high cost of housing is what brought us to this situation. One of the things that I see personally is that in the recession between 2007 and 2010, people lost their homes, they had too much house, they couldn't afford it, there was a lot of housing issues. When people come to me in my work, they have spent their resources, they have their Social Security, but they've had their home that's in many cases paid for, and that is what their security is. Ongoing, with the high cost of home ownership now, what's going to happen to the folks that can't afford to buy a home now? And that's our children and our grandchildren. So, the economics of housing has certainly changed. Whoop. Uh-oh. Okay, there we go. I have some current slides that speak to the numbers of homeless in Lane County right now. And just a little bit of information about Lane County. They track homeless people month by month. Anyone who comes into their system asking for a program or any kind of assistance, veterans, they mark in their homeless figures. So we have really pretty accurate descriptions or numbers that are pretty firm about how many homeless people are in our community. And the slides that I have show that month by month what we have, and then, there we go. And that there's a dip in the summertime. It's more comfortable to be outside. Life is a little bit easier when we don't have the temperate temperatures of the winter. And the good news I have, which I think it'll be helpful, starting in January, they will track senior homelessness and not just the younger families. It will be a specific number for the homeless that are over 60.
It's the space bar.
Oh, sorry, there we go.
Thank you. Thank you, Donna. My name's Judy Smith. I'm just going to talk a little bit about the housing crisis from national to state to then down to the county just rather quickly. You may not be aware, but the national average for rental availability is at a 95% occupancy rate. That means of all the available rentals, 95% of them are already occupied. So there aren't as many available as as are needed by people. I'm sorry, I'm a little nervous. The Census Bureau reported in September that 3.8 million renters will likely be evicted in the next 2 months. And that's one of the reasons why the rental crisis continues to get bad, because if you're evicted, then where do you go? Here in Oregon, we've got a slightly higher rental occupancy rate. Our state is at a 96.7% capacity. And in February, the U.S. Census found that 36.8% of our population in Oregon were behind on their rent or their mortgage, and they were in very real possibility of losing their housing due to being evicted or having foreclosure processed. And experts now are fearing what they're calling, and Donna's spoken to it, of course, is this aged homelessness. Because self-reporting, 40% of Oregonians over the age of 65 say that they are at risk for losing their homes. And that's scary. Here in Lane County, well, we're even higher. We average between 98 and 99% occupancy for rentals. And the median household income in Lane County is $4,478 a month. Again, that's an average for a household, not an individual. But if you're following that recommended, only 30% of your income should go towards housing. That gives you $1,374 a month to stay within that kind of budgetary restraint. And as Donna mentioned, a 2-bedroom apartment in Eugene. Well, when I got this slide made, it was just under $1,500, but they've gone up, and they're going to go up more. This year, all of the apartment rentals were allowed to go up 10%, and they are anticipating that rentals will go up another 14% in 2023. So it is a very serious situation. I'm going to turn this back over to Donna. She's got a couple more slides, but I'll be right back.
One thing I like to talk with seniors about is reimagining what retirement should look like. One of the things that's recommended in looking at retirement is that maybe you want to work longer, work more years. And I think the pandemic has really kind of spoken to that as well, when you can work virtually from home. But working longer means you do have more Social Security. And in these days, with everything else going up, as many resources as you can have is going to make a big difference. One of the things about retirement, and I think in some ways, because our culture, our seniors are healthier and they're living longer. 20 years ago, they'd say, you know, your 401k should last you 20 years. Well, guess what? People are living into their hundreds and in their 90s. So if you're only planning on 20 years, you might run out of money when you really do need it for care support. So looking at all of those pieces is really important. One of the things I always recommend is have a financial planner that you can talk with and an elder law attorney, because setting up the plan and knowing, and for your family, is a gift to know what your desires are, how you want things split up. What I see a lot these days are blended families, and you know, the husband and the wife get together, they've had children, maybe none together, but if they have children, you have all of these different entities in a family when the parents pass, and it can be very complex. So if you can be proactive to give your family that gift, it can really be helpful to them and to you when the time comes that you do need the help. Something that I talk to seniors about is prioritizing what's important to you. It's a time, you know, during my time, because we're all about the same age, you know, you want to look at retirement, many people have as the golden years. I'm going to go on vacation, I'm going to travel. What's really the most important thing? Do you want to be with your children in the community that they live in? There are 8 states that you don't pay any income taxes. Do you want to be in one of those states to make your money go farther? Do you want to consider, are you a vet? You know, do you want to be where there are good veteran medical services? That can be important. So looking at everything and trying to make an actual plan on paper is something that could be very helpful. One of the things that I'd mentioned too is long-term care insurance. If you have long-term care insurance, it can make a difference whether you have an estate or not. Many people want to leave money to their children or to their family. If you have a long-term care insurance that can pay for your care, you're in a much better position to make that happen.
Thank you, Donna. Well, I'm here to talk about solutions. We've identified the problem. We don't have enough housing. What's out there is expensive, and our seniors are at risk. So what can we do? Well, you know, I like to tell people HomeShare Oregon started out as an idea, or really a question. And here was the question a group of people up in Portland were asking. They wanted to know, what else can we do to get affordable housing for Oregonians? And they did their research and they did some brainstorming and they came up with the idea of HomeShare Oregon. And that's what I'm here to talk to you about today. We say that community begins at home. Let's see what that looks like. This is our mission. The mission of HomeShare Oregon is to expand access to affordable housing through home sharing. We believe that this is a direct way to prevent housing instability, foreclosures, and homelessness. We say it's the solution that brings us together. Did you know that there are 1.5 million empty spare rooms in the state of Oregon? If you look at that as underused housing, it can shift your perspective. Our board decided, they did a little bit of math and they set a goal. They said if we could fill 2% of those empty rooms with renters, we could find housing for 30,000 people. I live in Springfield, Oregon. That is half the size of my city. That is a significant number. We're not quite there yet. We've only been around for about a year and a half, but we're growing. And word is getting out with this idea of home sharing. Why is it a solution? Well, you know, it's mutually beneficial for the home provider and the home seeker. It's flexible, it's affordable. You know, the average price for a home share in our state is somewhere between $650 and $850 a month, approximately half of what an apartment would cost in whatever community they're in. And the way that we do it, it's efficient and it's independent. We think that it's a tried and true solution for a growing modern problem. And it is not a new idea. When my grandparents walked the earth, well, now, I'm in my 60s, so that's a while ago, but when my grandparents walked the earth, they called it taking in a border. And people did it, and it worked. So how do we do it in this century? I'm so glad you asked. Your first step would be to visit our website, homeshareoregon.org, and you sign up with us. What we do is we give you access to an online roommate matching service. I like to tell people it's a kind of a cross between Airbnb and a dating app. I know that sounds a little funny, but hang in there with me. Because what you do is both parties, the home provider and the home seeker, they all answer the same list of questions. And then based on location, because with this app you choose the city you think you want to live in, or where your house is, depending which role you're in, and an algorithm matches them based on compatibility. And I always like to tell people compatibility is really important, because if you're sharing a house, you have to get along. So what do you do next? You monitor your matches, you communicate through the app, and you're able to screen people without sharing your personal information or your contact information until you find the right person. It's important to start that dialogue, and we like people to do it through the app, again, because it's secure. And you open up this dialogue and you ask good questions, and if someone's not a good fit, well, you can move on. And if someone is, then you take it to the next step, because this is only the first part. There's more. I spend a lot of my time working with participants and coaching them along this route. I tell them I'm their home sharing coach, although I do many other things. But in building a profile, you've got to be thorough, you have to be descriptive. I want them to do it positively as well, but you got to be honest. Because if you paint a picture that is not true, you will not find a good match. And we always encourage the homeowners to put some photos on their profile, because people want to see what it looks like before they decide if they want to move in. Talking about finding the right fit, I've already said, you have that dialogue, but, we don't think a home provider should invite anybody over until they've met them, and we don't think anyone should go to someone's house if they don't know who they are, because there are unscrupulous people out there. So I tell them to meet up in a coffee shop or a library. I had 2 women in Portland that had dogs. They decided to meet at a dog park because they wanted their dogs to get along. It all worked out. But we give the tools and we give coaching to help people do this for themselves. HomeShare Oregon doesn't put anybody in your home. You get to make that decision for yourself. We're just giving you the tools and the coaching to do so. And during that conversation, you should come up with a plan as to how this is going to work. And we think that plan should be written up into your home sharing agreement. That's a big part of the security piece. That's also on this slide. You use the tools that are available. And having a home share agreement that's signed between both people, it needs to have more than just when the rent is due. It needs to have house rules and expectations and communication. What are you going to do when you disagree? You work all this out in advance, and you both sign it and agree to it. You use other tools. We pay for criminal background checks. We think both parties should complete those because both parties want to feel secure. And you have to ask the tough questions. If it's important to you, you need to talk about it. And my most important piece of advice is don't hurry. Take your time. Finding a good home share match is worth the effort. I'm putting up a slide now. I know the viewers or the listeners on radio can't see. There are home sharing testimonies. I'm going to let this sit here for a minute, but I'm not going to read them to you. I am going to tell you about one gentleman that I've worked with personally. His name is Robert. Robert and I met a year ago, October, down at the Eugene Saturday Market. I was sitting by a little card table talking about home sharing, and I'd been working for HomeShare Oregon for about 2 weeks, so I was pretty new. And he came by and we had a conversation, and he wandered off and he came back and he said, I just looked you up on my cell phone. I want to know more. Now, Robert is around 70 years old and has a mobile home. And he has been working part-time, but his health was, he had some health issues, and he really needed another source of income, and he thought this might be it, so he signed up. A couple months later, I met another home sharing person. Her name is Margaret. She moved to Eugene after her husband passed away, and she thought she could find an apartment with her $1,200 a month Social Security. She was couch surfing on her son's couch in a tiny house with his wife and her granddaughter, and there just really wasn't space, and it was getting a little stressful. So she signed up for home sharing. I helped her build her profile. She and Robert matched. They followed all those things that I tell people to do, and they decided to give it a try. She moved in New Year's Day, 2022. And in June, they decided that, yes, this is really working for us. And they've made a longer agreement with each other. And Robert called me one day, and he left a very long message, and I just put a little piece of it on this slide. He said, I am very, very pleased with my housemate, Margaret. She is a wonderful person. It's like a key fitting in a lock. I saved that voicemail. When I get discouraged, I listen to it because it makes me happy. So who do you know? We believe home sharing works for all ages and all demographics. We think anyone with an extra room should consider home sharing. It works for empty nesters. We've talked about seniors. Definitely works for seniors. I would say somewhere between 50 and 65% of the people I talk to are seniors who have a home that they're thinking about sharing, or they are a senior without a place to live, or they're about to lose the place they live because it has been priced out of their budget. So definitely seniors. People experiencing major life transitions, divorce, if your spouse passes away, or if you put a partner in long-term care and your finances are in awry, home sharing can help. People who need household assistance, Donna mentioned seniors wanting to age in place. Well, absolutely, but sometimes that big old house is more than they can handle. So they choose to match with someone who's younger and able-bodied, and they negotiate a lower rent for someone doing chores around the house. It can really serve them well. Obviously, people struggling with isolation, that sure came to the forefront with the pandemic, and people who are just looking for community and change. We are trying to find ways to incentivize our homeowners to consider doing this. And so to that end, we have some legislation that is going in front of the Oregon state leaders in January during the long session. It's called Home Share for Oregon, and the concept is pretty simple. This idea would absolve tax liability on the income you earn from renting out a room in your home. Now, this hasn't been passed yet, but it's being proposed. And it's for anyone who's willing to rent the space for $1,000 or less a month. And if you think that's a good idea, allowing people to get up to $12,000 a year tax-free by renting out a space, please go to our website, homeshareoregon.org, and click on the advocacy tab and sign up on our petition supporting this, because we think it's a really great idea. I don't have much more. I just want to leave you with our vision, because we envision a world in which every person has a clean, safe home, a world where home sharing is normalized and as a lifestyle preference. And by doing that, homelessness will be uprooted. I can't do this alone, so here's my challenge. Consider home sharing for yourself. If not for you, if you know someone this might work for, tell them about us. Word of mouth is the best advertising we can get. Consider joining my Home Share Oregon action team here in Lane County. I've got 3 dedicated people. I need a couple more. We need to move this forward. And if nothing else, go to our website and sign up for our quarterly newsletter and stay informed about what's going on with home sharing in our state. And my last request, if you are connected with another group like this Eugene City Club that likes to have people come and do presentations, whether it's your faith community, a service club, it could be your book club, I don't care. I would love to come and talk to you and tell you more, because we want to move this forward, and it's important. It's a creative solution for a difficult situation. My last slide is just some places where I've gotten some of the information I've shared with you. This is actually all I have to present. I believe in a little while we're going to take some questions, so thanks for listening.
Thank you, Judy Smith from Homeshore, Oregon, and Donna Courtney from Adult Living Solutions. We'll now take a 5-minute break to compose some of those questions for the question and answer period and be right back. Welcome back to the City Club of Eugene and today's program on preventing elderly homelessness. We are here with our speakers, Judy Cormana Smith from HomeShare Oregon and Donna Courtney from Adult Living Solutions, and we have a first question.
Hi, I'd like to ask how many people have been placed by HomeShare Oregon here in Eugene or in Portland?
You know, that's a difficult question to answer because we don't know if people have matched unless they tell us. Oh, thank you. This is a very short cord. So what I can tell you for specifically that I have just this week matched 3 different individuals with 3 households. One in Eugene, one in Springfield, and one in Medford. And that across the state, we have almost 800 homeowners who have signed up with us, and probably close to 3,000 renters.
Thank you.
So, thank you for the question.
Hi, my name's Andrew Calick. My question has to do with what you've learned from other programs that are similar to HomeShare Oregon. I know there's been efforts, for instance, at New York University. There's a program to connect graduate students with people in New York who might have a spare bedroom. And even here in Eugene, we see that happening organically. There's a few people on my block who have graduate students in their basements. So what have you learned from those other programs? Thanks.
Oh, that's such a good question. You know, most of the home sharing organizations in our country are case managed, and you have to qualify by income to get into those programs, and they're very, very regional. As far as I know, HomeShare Oregon is the only organization in our country that are doing it the way that we're doing it. Because some of those organizations, there's one in Virginia, has a staff of about 10, 12 people. And if they have a good year, they place maybe 60 people in homes. And that's just not fast enough. So by giving the tools to the individuals to do this on their own, it kind of speeds it up a bit. But I have met with some different organizations and gleaned some information and things, and I think one of the more interesting pieces in talking to the HIP housing down in San Mateo, California, is that they have learned after 35 years, which is a good long time, that when you have someone in your home, you shouldn't have them pick up the mail, because you have, and you shouldn't leave your private documents laying around. It's just too tempting for people. So security is really important, and we do try and coach people along those lines.
Thank you.
Hi, I'm Jerry Smith. I volunteer at First Christian Church, giving out clothing to homeless people Tuesdays and Thursdays from 12 to 2. So I see a great number of homeless women and such. Who should I give these to?
Well, that's such a good question. Like I said earlier, we believe anyone looking for affordable housing can sign up with us, but because of the technology piece, if they don't have access to technology, it can be a little bit harder. So honestly, you should have them either call our offices, which if they're in this area, they'll be referred to me. I share my cell phone number with people to call me directly because it speeds it up a bit and it's more convenient. But you need to know that HomeShare Oregon is not always the best place for an unhoused person to look for housing because sometimes they have other barriers. HomeShare Oregon is about preventing people from getting unhoused in the first place. If you give an affordable place to live to a person, if they can afford it, they're not going to end up living in their car.
I do see people who are just in the first few weeks of it, as well as people who've been out there for 20 years.
Anyone who is looking for affordable housing can sign up with us. We just can't promise they'd find someone, all right?
Okay.
We give them the tools, we give them encouragement and access, but they have to have the capacity to move it forward.
Thank you.
Thank you. It's a good question.
Good afternoon. Thank you for coming and spending your time with us. I'm Sharon Reed, City Club member. My question is going maybe to some of your statistics also. Are you maybe seeing like a pressure point or another wave coming as we continue to lose, or individuals lose pensions now are no longer going to be that part of an income. And as your slide showed, I think people have a very unrealistic idea of what Social Security is. And so as pensions start to move away, and you mentioned 401ks, but then I'm also one of the generation where that didn't exist, and I was just smart enough to move into it, but others had no opportunity to use that. So they come to this age where they just don't have the income to move into things. So I'm just wondering, are you seeing that maybe even in another 10 years, as people have not taken advantage of these optional things and pensions are no longer there, that there may be yet another growing wave of unhoused and unaffordability?
It's true. I do believe that. And in fact, I have concerns about next year. Our government in the state of Oregon is allowing rates for apartment rental to go up a little over 14%. Well, here's the thing. It's going to go up 14% in many of the assisted livings and memory cares because they're considered short-term, or they're considered rentals. And currently, to get into an assisted living, you're looking at $5,000 to $6,000 a month. And in memory cares, $8,000, $10,000, depending on your needs. But I think this is just a crisis that is a bubble that's going to happen. It's here. And I don't even know how you plan to try to take care of it because of the sentinel events that can happen. I work with a family currently. They have long-term care. They covered that. They were people that were good stewards. And the husband is having to pay $20,000 extra for a caregiver to be with his wife because we can't keep her safe. So the long-term care is paying for her memory care. He's paying an additional $20,000 a month. And so we're all very concerned.
Mary Layton, City Club member. We actually had a conversation here about healthcare for all Oregon, single-payer healthcare. Will any of these law changes, policy changes in Oregon, I mean, are any of them likely to address the problem you talk about? I mean, that level of cost.
You know, that's a very good question, but the single-payer system is so far out there, and the legislation that it would take. I come from a background with private insurance, working in insurance. I've worked for the state of Oregon through Oregon Health Plan for the folks that have Medicare and Medicaid, and the costs have increased so much that I don't see that happening in my lifetime.
A question from our table, second question. Social Security and Medicare have brought levels of elderly poverty down tremendously in recent generations. Would increasing Social Security benefits meaningfully affect the homelessness crisis for seniors? To what extent is elderly homelessness a symptom of poverty versus other factors?
That's quite a question.
It's a very smart table.
Where I start. Well, Medicare is going, Social Security is going to be increased starting in 2023 by 8.5%. But the cost of living has gone up so much from the pandemic. So when you have costs of transportation, you have costs of workers for caregiver support, the costs have increased so much, it would have to be a significant amount of increase for Social Security to address the costs. And Medicare actually is going to be going down a little bit in 2023. There were some costs that they had expected to get on some drugs that did not occur. So it's going to go down a little bit. But I don't know what the fix is of this problem. I don't.
Andrew Calick again. A question from the audience. Speaking of what the fix is, Karin mentioned how America is graying. America's not alone in that, though. Much of the world is graying. Are they facing the same or similar challenges to the United States with regard to homelessness for older residents? And if they are, what are they doing about it? Or if they aren't, what have they done so that they don't face that challenge?
You know, I can't speak for the whole world. Our organization just joined the International Home Share organization last month, and I was on vacation when the first meeting happened. So I'm a little uninformed, but I can tell you one really great idea, and it comes out of Stockholm in Sweden. When they send their students off to college, they don't have dorms. They place them in senior homes. And they help them around the house, and they pay a little bit for, you know, for room and board, and it's just a really creative solution. It's a small country, it works for them. I think what we're gonna have to do is get very, very creative locally, all right? And the idea, you know, home sharing, if you rented a room in your home as a senior and got an extra $800 a month, I don't know about you, but in my budget, that's a significant amount of money. And I have home shared, and it's tricky. You have to find a good fit. But it does give added financial resilience to the home provider. And I'll be very honest, most of the people signing up are seniors because they are the ones that own the homes. So it's one piece of a very complex puzzle. But I think, you know, looking for local solutions, and you know, if like I said, if we can get 2% of those empty rooms filled, that's a substantial amount of housing at an affordable rate and giving the homeowner some financial resilience. Thank you.
We have a related question that almost is like a follow-up to that question, and it's really a request for clarification. Why is it so important to, quote, age in place, unquote? What does this have to do with health and happiness or safety in community?
Well, historically speaking, your primary care, or the physicians, the medical community, have believed that seniors do better health-wise, cognitively, to stay in their home. Making change is hard. And aging in place was the goal. What we're finding now is that people can age in place to a certain time, but if they wait too long to try to access care or a care community, they cannot make the change cognitively. If you can go into a community when you can understand, okay, this is breakfast, this is lunch, this is dinner, this is how everything works. Your brain can learn the routine and is able to have quality of life and be successful in a community. If you wait too long, you don't have the success rate of a good match to be able to find a community that works for you. And so there is an encouragement for the folks that work in communities and work in this field to try to encourage people to plan ahead for the time when things just don't work for them. And can't tell you the number of seniors that I have met with that their family just doesn't know what's going on in their home. Whether they're leaving the stove on, they're leaving the water on, bad things happen. People can take financial advantage. Just a lot of bad things can happen, and you do need oversight. So if you can try personally to try to think, okay, what is 5 years for me going to look like? When might I be able to think about making a change? Because our culture doesn't do that. We're independent, and we're going to stay independent, but it just doesn't work that way anymore.
Another question coming in from one of our members, and a little bit related to something you just mentioned, Donna. Does HomeShare provide support or resources for when things go sideways? Like, what if someone needs to evict a person who is staying in their home for non-payment of rent, or the pairing doesn't actually work out? What does that process look like?
Oh, that's such a good question, and we do address that. When I mentioned a home share agreement, what I should have also pointed out is that having a signed agreement is, we can't make anybody do anything, but we highly recommend that you have a home share agreement signed. And it should include a clause that says, if for any reason this isn't working for either party, because sometimes it just does not work, we agree to dissolve it with 30 days notice. You should also have something in there what you're going to do if they don't pay their rent. And you can say, you can put that in the agreement, but it all needs to be figured out in advance. We have home share agreements that can be customized by the people, and we encourage them to collaborate and work on it together so they both have ownership. So having that signed agreement in place is the best prevention that you can have. I do know that, you know, there have been a lot of stories that have come, especially during the pandemic, when tenant and landlord agreements had, you know, they weren't allowing people to evict folks. And so a lot of people ask me, well, what about that rule that says you can't make someone leave? Well, thankfully that evaporated at the end of December last year. But we find that if you go through this carefully and you make that agreement and you're very specific about expectations and what's going to happen if, and you both sign it and make it a legal agreement between the two of you, prevention is, an ounce of prevention is better than a pound of cure. So that's how we address it.
Thank you.
Andrew Calic. Most landlords are subject to state, federal, and local anti-discrimination laws. They can't discriminate on the basis of various classes. It's a little different with home sharing, but I wonder what, if anything, you can do to prevent implicit or explicit discrimination. You mentioned how important it is to have a fit, and I certainly understand that, but is there anything you can do to mitigate that risk of discrimination in the matching process? Thank you.
I think the best thing to mitigate discrimination is education. And, but people tend to want to match with people they get along with. And so if you have people that are diametrically opposed on any issue, whether it's politics or, you know, people can disagree on all sorts of things. It's just important to have that conversation first. We do have a statement on our website that we support equity, and I can't quote it to you. I probably should memorize that one. But we encourage people to open their hearts and open their homes, but people will want to match with people that they can live at peace with, and in, you know, you want to be comfortable, you want to be secure in your home, whether you're the renter or the provider. So it comes down to education and giving people a chance and meeting them and having that conversation. I find that it's the unknown that makes people fearful. And I think my personal opinion is discrimination is based out of fear. And if you can open your heart to a conversation and explore options, you might be surprised by the positive results. I also know that, you know, my executive director, Tess Fields, is home sharing currently. She actually has a couple in her home that fled the war in Ukraine. But prior to that, she's matched with other people, and in the process, she has come up with the perfect question, because she is, she does not want to match with someone who has different political views than her own. And this is a great question, so you can tuck it away for future use. But she asks them, so where do you get your news? All right, so if their news source is diametrically, I'm not even saying that, if it is opposed to what you want to listen to, you might consider looking for a different match. There are ways to screen people, so.
I have one more thought.
Yes.
You know, you may have heard lately of a terminology that was new to me called a super senior. And super senior, they age well. And by aging well, what they're doing is they're engaging in their community, they're engaging in social pursuits, they're not in their home by themselves, isolated. The thing about aging in your own home by yourself is the isolation. As a person grows older and they're isolated, their world gets smaller. They're not reaching out even to neighbors, or how do you get your groceries, or you're no longer driving. But being a super senior and trying to do the best you can, be as active as you can, and engaging in social activities has been found now to be one of the best ways to age well.
We have time for one last quick question and a quick answer, and it is appropriate as we head into the holiday season. it's hard to talk with your family about finances, and it's hard to talk with your parents about whether or not they have enough money saved. How should adult children engage this conversation with their parents if they're concerned that they may not have the resources to be stable in their housing?
Should you take that or me?
Oh, honey, that's a tough one, because I have adult children and they've never asked me that. You go ahead.
I deal with this a fair amount. Because of the cost of care, and the scenario is it's not a quick answer, I'm afraid. So a sentinel event happens, okay, mom can no longer live alone, she needs to go to assisted living. There is, in the state of Oregon, called Spend Down, but you have to go into a community that you get to pick that has a Medicaid contract, but you have to have around $20,000, $30,000. We see a lot of variability in what a community will take. Kids don't know what their families have. In our particular family, we have a trust, and we have laid down, and we're a blended family, that who gets what. If there is a trust in place, it would be good to just tell the kids there's a trust in place. And have your papers together so when something bad happens, the kids even know where to go. I've had folks that had long-term care insurance. It was never accessed, and this family paid thousands and thousands of dollars when it could have been taken care of. So what a senior should do is engage, but what the kids should do is don't be afraid to ask. What's the worst thing that can happen if they say it's not your business? And seniors are very sensitive about their money and their resources, but it's a matter of needing to know. Just in case something happens, what might we think about, or, you know, where do you have your banking? Is there a book that we can put together that we can put all that information in, so if something happens, we'll know what to do? So the adult children trying to engage in a way that's not confrontive, or one of the things about aging is it's not unusual for seniors to become more paranoid. The kids are after my money, or you know, a lot of things that folks didn't have earlier in their adult lives. You see behaviors that change. So having the conversation sooner than later is a good thing.
Very good advice as we head into some family dinners over this holiday season. This has been our December 2nd, 2022 City Club of Eugene, Preventing Elderly Homelessness. Before we thank our speakers one last time today, I also need to thank and recognize our Diamond sponsors. Kaiser Permanente exists to provide high-quality, affordable healthcare services and to improve the health of our members and the communities that we serve. More information is available at kp.org. The University of Oregon has helped Oregonians to question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically since 1876. And you can find more information at uoregon.edu. Peace Health has been proud to serve Eugene, Lane County, and beyond as your hometown healthcare partner for more than 80 years. The Peace Health mission is to keep you and your family healthy, and you can learn more at peacehealth.org. Lane Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, please visit lanecc.edu. And we also thank the City of Eugene and Lane County for their support. Thank you also to today's Sapphire sponsor, AARP Oregon. AARP is dedicated to empowering people aged 50 plus and keeping Oregonians informed, engaged, and active. And you can learn more at states.aarp.org/Oregon. Thank you to our gold sponsors today, Homes for Good Housing Agency and Headshots Eugene, as well as to our in-kind sponsors, KRVM 91.9 Radio, Pack Info and Simplified Computing LLC, and Dotson's Photography. And of course, a special thank you to our award-winning public radio station, KLCC FM 89.7, for airing City Club programs on Mondays at 7 p.m. You can find all recent City Club programs archived on KLCC, as well as our YouTube channel and as podcasts. Please join us next week on Friday, December 9th at 1:30 p.m. when we will welcome experts in child and adolescent behavioral health from the University of Oregon's Balmer Institute for Children's Behavioral Health. We've talked a little bit about this when we welcomed UVO's interim president, Patrick Phillips, the other week, but this is a remarkable new initiative of the University of Oregon, supported by a $425 million donation from the Balmer family to address an adolescent mental health crisis. The following week, on December 16th, we are also delighted to close our 2022 calendar year with City Club's annual Gifts to the City program. 10 distinguished Eugenians whose community involvement gives them a very unique perspective on the community will be invited to imagine that you have a magic wand and can use it to produce a gift for our city to make it a better place for all of us to live. What would you give? The answers are always inspiring, leave us thinking about what we each could contribute and give to our community, what we would give if given that magic wand, and we will be happy to host this program at the Davis Restaurant in downtown Eugene on December 16th at 12 p.m. We hope to see you there, invite you all to join us for some early holiday cheer and inspiration. We are also currently planning our 2023 programming year, so please, if you have suggestions, reach out to us at cityclubofeugene.org. Suggest a program. We welcome everyone to join us in this conversation and to help us think more critically about the community of which we are all a part. Finally, one last thank you to our speakers today. Thank you for helping us to think about this issue that impacts all of us directly and indirectly in community. Julie Karama-Smith from Homeshare Oregon and Donna Courtney from Adult Living Solutions. Thank you for being at City Club. And thank you all for joining us today at the City Club of Eugene. We will look forward to seeing you next week. Take care until then.